Hello, my name is Ayelet Connell and I'm the president and founder of Manual Therapy Seminars. I wanted to talk in this video a little bit about the early history of IMT. Integrative Manual Therapy was developed by Sharon Weiselfish Gimateo, who was my mother. She was brilliant and wonderful, and she was responsible for an enormous contribution of knowledge to the field of healthcare today. And many of us that have studied with her for many years and work with clients today are blessed every day for having this enormous compendium of material to use and to see benefits in our clients. But the early history of IMT, the early history of Sharon. Sharon was a Canadian. She was born and raised in Toronto, and she moved to Israel when she was 18. And she went to physical therapy school there. It was a very vocational-based program, and she ended up working in a military hospital afterwards. And then eventually moved to the United States, where she ran a team of physical therapists at Mount Sinai Hospital in Hartford, Connecticut, and did a lot of educating there of her team. But early on, my mother used to love to say that IMT was developed because of me and how sick I was when I was born. I was born with a collapsed lung. I had a hole in my lung when I was born, and I had a very important surgery, a lung surgery, that certainly saved my life. But after the surgery, I was still so ill and so symptomatic. I had a lot of concomitant issues that were related to that original collapsed lung. I had scoliosis because of all the pressures in the chest cavity from the lung being collapsed. I had close to where the hole in the lower part of my right lung was, because of the pressures, it burned through one of the main lymphatic vessels that's significant in draining the internal chest cavity. And because of that, I had a lot of lymphatic swelling or lymphedema for my early years. Because of the lung surgery and how sick I was in an incubator for the first month of my life. And in the incubator, there was a lot of oxygenation that was pumped in to help me thrive. And at the time, a lot of babies in incubators were developing blindness because the excessive amounts of oxygenation was causing a lot of scar tissue along the nervous tissue for the eyes and some of the visual tissues of the brain. But at the particular hospital that I was at, they were doing regular testing of blood gases of babies in incubators. And as a result, they were able to modulate it a little bit. So I didn't develop blindness, but I definitely had my share of scar tissue and visual challenges. And I also had a lot of learning challenges when I was younger, reading and writing comprehension in particular, and very likely very relevant to some of the scar tissue that I developed from the oxygenation. But as you can see, a lot of issues. I was a sick child for sure, and my mother brought me home from the hospital, and she didn't have answers. And for my mother, that is a classic example of who she is, who she was. She went to the drawing board and she started to develop techniques, and she had not just myself and of course my brothers with their various sports injuries and things of that nature as guinea pigs, but a ton of clients. She was essentially managing a team in various hospitals that she worked in. And she was able to try out these techniques, these very gentle bodywork techniques. And over the years, she developed this enormous compendium of techniques that we oftentimes refer to as the integrated systems approach, because there are techniques for every tissue and system in the body. It's just remarkable. For myself, with the integrative manual therapy intervention, as well as some functional therapies that we intersperse, like vision therapy and swimming, things like that, I am so healthy today. Let's see, kind of the inventory. I don't have scoliosis. That was definitely something that shifted when I was much younger. My lungs are very strong. I have very strong respiration. I actually grew up being a competitive long-distance swimmer. Learning is definitely not a challenge. I have my doctoral degree today, which certainly required a lot of studying and learning. My doctoral studies is focused in the field of neuropediatrics. So that means working with young kids that have neurologic challenges, whether it be cerebral palsy or autism, learning disabilities, other types of related disorders. And my vision is pretty good. And the integrative manual therapy was definitely my health care. It's what I received frequently in my childhood. I received a ton of treatment, and at the time maybe I wasn't so excited about it, but certainly now I'm so grateful for all those countless hours on the table receiving therapy. And my mother was remarkable in the development of it. But over the years, originally IMT maybe was more focused on muscles and bones and joints and maybe the nervous system. But over the years, as we encountered more and more clients with challenges that we didn't have answers for, and my mother then would go and do more research and develop more integrative manual therapy, she developed techniques for every system in the body. This is where we refer to the integrated systems approach. There are techniques today for all the organs in the body, for all of our muscles, not just skeletal, but also smooth muscle that lines all of the autonomically innervated structures, like our organs and our diaphragms and all of our arteries and veins. There's techniques for the entire nervous system, not just the general brain and spinal cord, but also all the subcortical tissues. There's techniques for the eyes, for the inner ear, for all the speech and swallowing tissues, and so on. The immune system. There's a beautiful section of IMT for more body-mind, for working with the mental body and the emotional body, and repressed energies in our body. It's a really beautiful, beautiful compendium of material that gives us a lot of tools as integrative manual therapists to help people with a wide range of issues. And at the forefront of all of it are the diagnostic techniques that my mother developed over the years. And I will say, she used to say this all the time: if you have a client on your table for an hour and you spend that whole time treating the person with integrative manual therapy, there are so many techniques that if you don't spend time doing diagnostics, you won't necessarily be as effective. If you take that hour and you spend a good chunk of it doing integrative manual therapy diagnostics, hands-on techniques to really understand what's underlying, and then choose the right IMT techniques, you see the most dramatic changes. So thank you for listening to this short early history of integrative manual therapy and of my mother Sharon, and I hope you tune in for some more information on IMT. Thanks so much.